Greetings and welcome to Can TV Live. Honey, you are with Sister Yaa, the hostess with the mostest for TACS, the Association of Clinical Trial Services, and this is our monthly program where we are coming here to bring the science to the people. That's what we do. My name is again Sister Yaa. I'm your favorite community epidemiologist, and we're also here with Baba Charles. If you want to call in live at 312-738-1060, and that's the call in live. I will be letting you know that if you really wanted to call me direct, you can call at 312-961-6189. That's the number for TACS, or go to Facebook at taxus.org, and tax, as you can see, Facebook, Tax Us, I'm sorry. And then if you go to the Facebook page, you can contact me there, and we're working on the website. It's always some work in progress when it comes to us. So what we've been doing is really always talking about our whole concept about diversity and cures and clinical trial research. So that's been a part of who we are and what we do. And then, of course, our main impetus for being here is always to keep in front of you what is health equity. Health equity means getting what you need to get to make sure you do the best that you can with the health that you have. So as you can see with the bikes, if you don't have the right size bike, you can't ride. So we want to ride, right? And if you want to ride, you need the right size bike. If you want better health, you need the right size health. And that means all aspects of it. That means your insurance, that means your access, that means your fruits and vegetables, that means your mental health, that means not using and abusing substances. It means all of those things, and we call it wellness. So that's one of the things that we talk about, and I always give a shout out to this particular concept, a case for health literacy, moving from equity to liberation. That's what we're doing, and we're definitely not looking at just equality. We're looking at liberation with this getting what you need to get to have a better health, and it's not just stopping at equity. So I love that graphic because it helps me to remember why I'm in this game and why I like to deal with public health. So I also want to give the shout out. Hey, today and welcome is Juneteenth, y'all. If you didn't know what Juneteenth was, Juneteenth means that we deal with the day that they supposedly, Lincoln, wasn't my favorite president, but Lincoln signed a bill that was to emancipate those who were enslaved down in the southern regions. Now let's be clear, people have the misnomer of thinking it freed all the slaves or the enslaved Africans. No, it did not. That is erroneous. It freed those who were fighting in the southern areas of the United States against the North because they were losing the Civil War. And that war, as erroneous as my colleague will say, he talks about, well, it was about economics. No, that was not just economics. This is why he's flawed in that. It was not about economics. It was more about power, and it had nothing to do with just what the sales of bills were. In fact, from this actually came to how they denote who could vote and didn't. It was about land and power. And anybody that tells you economics actually doesn't get the fullness of what they were really going after, which is to be the people who they felt was superior to the people that they felt wasn't even human. It is not about economics, and I can stand on it. And this is one of those things that proves it. Juneteenth was about emancipation. It had nothing to do with who was making what money. It had everything to do with who was going to be winning the war. And part of the pawns of the war was us as enslaved Africans, and thusly is a commemoration of that of which they call freedom. But are we truly free? The answer to that is no. But we take what we can get, honey. Celebrate life every day, and this is just one of those things. So I give acknowledgement to the concept of, and we'll see it again, what you call Juneteenth. I give acknowledgement to it. We celebrate it as people of enslaved, who were enslaved. We're African people. We're African descendants. We're people who are in America who are African and black. We celebrate it, but we are not free. Because freedom comes with privileges that we don't get. And we're going to deal with that. So That's one thing, but guess who else? Mr. Patton is sitting there waiting on you all, the people's counselor, to give him a call at 312-738-1060 because he wanted to talk about a topic, which I think he should have come on and maybe we could have guest host or something together, but give him a call because he brought to my attention that June was also Men's Health Week. So, honey, you know, I was looking for some healthy men. There it is, right there, baby. Men's Health Week, yes. So when we talk about Black Men's Health Week, of course, that's what we're referring to. June is also one of those times that we reflect on it. And I actually had this question. I mean, I'm going to go into some other things for our presentation that I didn't get to do last month. And I want to make sure that I put that out this month. But are Black men's health better while they're incarcerated as compared to when they're out? Of course, non-incarcerated, right? Now, listening to that question, you may say, why would she ask, is your health better when you're locked up versus when you're out? Well, the reason being is because unlike, I don't want to say it, but it's an institution. It is not an institution of exalting, of course. It's not an institution that helps one to be inspired, but it's an institution that is given the charge of taking care of you while you're incarcerated, you're locked up. And with all of the systemic concepts, and it's a system, are they doing good with health? Now, initially you may think, okay, they got access, because where are they going? Right? Access is there. You've got a system, you've got order, you've got the numbers, you know who and where people are, and why is it in a system such as that, their health care may not be as good as somebody that's out with no access to health care, no health insurance, no nothing, and their health may be better. The reason that we're bringing this up is because there was brought to my attention that Black men are living in prison. Their life expectancy isn't longer. Let me be clear, in the United States, it's hard to talk about Black men's life expectancy because the census tract doesn't go by Black men, Black women, blacks, it just goes blacks. And from that, we do know that, Black compared to whites in the city of Chicago are definitely living to about 78, 79, whereas blacks in Chicago, 77, whereas blacks in Chicago are living only to 71 years old. That's the comparison. And again, this is based on some statistical aspects of what life expectancy is before you reach the age of 75, but based on that data and the projection that we have for every person born that didn't reach 75, Black people, we call it years of potential life lost, have a much greater years of life lost as compared to whites. In fact, it's almost double years of life lost. I actually do know the statistics on that. And it's, for example, for 8,000 so white people who have their years life lost by the time they're 75, there's 14,000 Black people who lost their lives before the age of 75. So again, almost double of years of life lost. So we call it years of potential life lost, YPLL. And if you ever see that data, I've been told that people don't understand it, but that's because they didn't have people like me explaining it. But more importantly, what does it mean in the end? Bottom line is we're losing our lives before we're age 75, and that's what that means. And the statistics are showing the life lost, not only that, but the years of life living for Black people is 71, and it's even probably further down than that, probably around 68 for Black men and a little higher actually for Black women. So once again, we're in this conundrum of what we're thinking about Black men's health. And as we think about Black men's health, we have to think about why is it their health is not as well. So overall, their health is not as good. Then if they're incarcerated with a system that is supposed to provide shelter, clothing, and food, and what? Substance, as in taking care of you, your health should actually be better, because where are you going and you should be able to see a doctor, you should be able to get the treatment that you need, and more importantly, you should be on a regimen that's there because you're regimented in jail anyway. We all know that that's not the case, but I argue for the case, and if you are incarcerated, then your health care should be attended to, because that is what the taxpayers are paying for. Why are you there if you're going to go there and be sick? Then we might as well not have you there. So again, aging is one of those concepts that's coming out. I even heard the term hospice care. And of course, there's been studies done to show that black men who have aged are less likely to commit another crime or so as compared to young black men. So, or any young person for that matter. So we know that hospice or types of different alternatives to housing should be brought up. And if you're interested in that kind of thing, you should call us, because we do believe in the people's having their community corrections, which means you should probably live in a facility, not a prison, but a facility that is controlled to do some of your time, because you don't need to be in a prison, but in a constructive and structured housing process that not only helps you to live better, but be productive in the community. That's where real community corrections is, and that's what TAX is going to be, as well as other organizations. That's something that Charles Patton the People's Council is very much into. So if anybody's listening and know about those things, please call us. But again, I want to focus. Let's see this picture of Candy, this is good to see these black men look healthy, at least. And they're talking about all kinds of issues around their abs and losing their gut. So message to people that should work on that thing. But again, black men's health is something that we want to acknowledge for June. And if you have any questions about where could you get care, or where should you go, then let us know that as well, because that is something that it should be easy to do. Just like you know how to get a driver's license, you should know how to get a primary care doctor. And if you don't know how to do that, then we've got people to help navigate you through that process. There's no reason that you shouldn't. There is absolutely no. If you got a driver's license, if you got a certificate of school, bachelor's degree, then you don't have a primary care doctor, that's your fault. Because there's no way that you can walk around and not ask the question of how to get this done. You can walk into any hospital, even if you walked into the emergency room, which I don't encourage, because you incur more costs, but walk into the emergency room and say, I need a primary care doctor. Help me navigate this system. They got patient navigators. They have people that do this work. It's a plethora of them. But it's an old African saying, closed mouths don't get fed, baby. And if you're not opening your mouth, you can't get the health you need. He who conceals his disease cannot expect to be cured. You got to talk about it and deal with it. So let's get into the topic that I really came here to deal with today, and it's a harder topic, and that is we're going to deal with violence as a disease. Woo, honey, you talking about black men. So what is meant is by violence as a disease? The definition that I'm definitely using here is different forms of violence often share the same individual or relationship between the community and society risk. Physical injuries, we talk about cardiovascular, gastrointestinal, reproductive and muscular, or nervous system. These are physical body injuries. Emotional abuse, mental challenges. And what do we say right there at the bottom? Put your eyes at the bottom. What does that say? It says hurt people do what? Hurt people. But if hurt people, what if healed people can heal people? Honey, don't tell me about generational hurt when we can talk about generational healing. That's what I'm on. So basically, as we're going to be closing down, I have less than a minute. I'm going to finish this concept very soon. We're going to be talking about what it means as violence, what we're doing with our elected officials. We're going to get more into the statistics around violence. And more importantly, I want to give a shout out to Pastor Anthony Williams, whose unfortunate son was taken by violence, but he put the fire in me and inspired me to look at this in a scientific way so we can get legislative passed. I've been told that we are working toward that type of, resolution was passed as violence, but we're going to do more to make it as a disease. So again, I got to wrap up, but if you want more information, you got mine. Of course, you can always email me. I prefer that, taxforus@gmail.com. You got the People's Counselor. His phone number is 988-34 411-773 area code. And again, this is your favorite community epidemiologist, Sister Yaa. I'm here with TACS, the Association of Clinical Trial Services. Want to give a shout out to all our peoples that watch us and those who are supporting us in TACS. And we'll be here once a month until we can do better, know better. We gonna heal ourselves. Thank you so much, and I hope to see and hear from you soon. Signing off.